Our stories are compelling, and we tell them in a number of ways. Newsletters, events, videos, brochures, media outreach, and visits to programs. All of these venues show you how lives have changed for the better as they've come through our programs. But how does this affect you? The Connection was founded on the premise that it must cost the taxpayer less than if the government provided the service, or cost society more if the service were not provided at all. The return on investment of preventing or stopping a life of crime or substance abuse is exponential. Here's the Connection by the numbers. The following brief video is a quick statistical run-through of just some of the financial benefits to the state of Connecticut and its residents. So thank you for taking the time to learn more about what we're doing in Connecticut and how it's benefiting you and those you care about.
The cost of neglecting mental health issues in the system is far greater than providing proper treatment. The complications resulting from clients with mental illnesses can be devastating to one's quality of life. Those same factors affect the greater community, often resulting in ruined careers, disrupted families, or homelessness. These factors, in turn, put financial strain on both the individual and Connecticut's valuable resources, expensive hospital stays or emergency visits, and use of law enforcement or potentially prison. Mental health issues and substance abuse are at the heart of many of our clients' difficulties, and we know that with support all individuals can participate in a recovery process which allows them to overcome or manage their disease, as well as live in a physically and emotionally healthy way. In order to address the needs of our clients and the communities in which they reside, we offer a wide array of residential, outpatient, and community-based programs.
Despite efforts to reverse the trend, a new report says that hundreds of foster children must live in costly congregate homes instead of being placed in family settings. About a quarter of some 4,000 abused or neglected children in the custody of the state live in orphanage settings, according to the Connecticut Voices for Children. About 90 children a year age out of Department of Children and Families care when they turn 18 without ever having been placed in a foster home. We join forces with DCF in their critical work, and our alliance strives for success with each and every case. Whether we're recruiting parents for our therapeutic foster care program, reuniting families who have been separated, or working with mothers and newborns to prevent separation, our goal is to make sure each home is safe and nurturing.
In the past 2 decades, state general fund spending for corrections has seen a 300% increase in the U.S., outpacing other essential government services including education, transportation, and public assistance. Today, national correction budgets total more than $68 billion a year. Research shows that strong community supervision programs for lower-risk, nonviolent offenders not only cost significantly less than incarceration, but when appropriately resourced and managed can cut recidivism by as much as 30%. Diverting these offenders to community supervision programs also frees up prison beds needed to house violent offenders and can offer budget makers additional resources for other pressing public priorities.
Before I came to the Connection, I was living in a terrible place, and I felt overwhelmed by the responsibility of being a mom.
32-year-old Seda grew up mostly in Connecticut and had a difficult childhood caused largely by behavioral issues related with ADHD. At 17, she moved out of state and returned just a few years ago with son Luis and daughter Julia.
I didn't have any family nearby, and I needed some positive support in my life.
Seda was referred to the Connection Supportive Housing for Families program. Caring staff, including case managers Samantha and Reagan, found Seda and her children an affordable apartment in a safe neighborhood and urged her to get her high school diploma. She enrolled in an adult education program in the New Haven area and addressed a packed auditorium at commencement.
I felt really honored. Next to having my kids, that was one of the happiest days of my life.
Seda says her life transformation and experiences with the Connection are inspiring her to consider a career in the human services field.
Samantha and Reagan told me even people that made mistakes in the past deserve a better life for themselves and their kids. They showed me that with positive perseverance and determination, any goal you set is achievable.
Thank you for allowing us to present The Connection by the Numbers. For 40 years, our caring professional staff has been transforming the lives of individuals and families in every part of Connecticut. Each month, some 6,000 deserving children and adults are served through our nationally lauded supportive housing, community justice, behavioral health, and women and children's programs. We've become a recognized leader in human services and community development, but we can't do it alone. We extend our heartfelt appreciation to our caring funders and other contributors who make it possible for us to carry out our mission on a daily basis. Will you stand with us in this valiant effort to improve the human condition throughout Connecticut? Learn more at theconnectioninc.org. The Connection, building communities, rebuilding lives.